Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Paracetamol. Paracetamol is a phenol derivative. This is a short-acting drug which is well absorbed and undergoes glutathione conjugation. It is a hepatotoxic drug by a product called as NABQI, which is N-acetylbenziminin, is produced. Then, paracetamol is actually a drug of choice for all the conditions where aspirin is contraindicated. If aspirin cannot be used in them, we can use the paracetamol. Side effects of paracetamol is it causes hepatotoxicity is seen, and thus this accounts for many of the hepatic transplants in many countries is because of this paracetamol toxicity. Even 4 grams of paracetamol can produce hepatotoxicity in congestive heart failure patients or cirrhotic patients or in nephrotic syndrome patients. Then we have a metabolite. Paracetamol will give rise to N-acetylbenzoquinamine. It gives rise to N-acetylbenzoquinamine. So this is NABQI, N-acetylbenzoquinamine, and this will result in centrilobular necrosis of the liver. It causes centrilobular necrosis of the liver. Then this paracetamol-induced hepatotoxicity is most commonly seen in alcoholics. If this causes centrilobular necrosis, then first the patient, after taking huge doses, that is of around 4 grams of aspirin, the patient will be asymptomatic for up to 48 hours. After that, the patient develops nausea and vomiting, followed by liver enlargement due to centrilobular necrosis. So the treatment of the paracetamol poisoning is we should give an activated charcoal can be given or gastric lavage can be given so that this will absorb the remaining paracetamol. We can also give we should also correct the acidosis. Treatment is N-acetylcysteine is given as a specific antidote. This is given as IV. It is given within 24 hours, then it gives best result. It causes liver transplantation should also be done. Then if required, especially if required, liver transplant has to be done. Then hemodialysis can also be done for the paracetamol poisoning. But the best antidote is or the drug of choice for paracetamol poisoning is N-acetylcysteine. One more important thing is this paracetamol will mainly block the COX-3 receptor. Because it blocks the COX-3 receptor, it is definitely an antipyretic, but it has no anti-inflammatory action. This has very little GI toxicity. The main toxicity of paracetamol is in the liver, that is hepatotoxic agent.
thank you and thank you for watching.